Hi everybody, it's Dr. Jenkin at Dermatology Associates here in Seattle. This is May, it's Melanoma Awareness Month, and we've just finished our first free skin cancer screening here in the clinic this week. I had lots of patients come in to be screened, and I think we all had fun doing that. The question that people asked us most was, what does a cancerous or suspicious mole look like? What are we looking for? What should they be looking for? And the answer that I give people is that we need to find what we call the ugly duckling. We're looking for the spot that doesn't look like the rest of your spots. It doesn't matter how many moles you have. If you're going to develop a skin cancer, it most likely is not going to be in one of those pre-existing moles. About 85 or 90% of the time, it's going to be on otherwise normal skin in a brand new lesion. Well, a brand new skin cancer is not going to look the same as one of your old moles. It's going to be somehow different. It might be a different color. It might be a different shape. It's also going to be evolving. It's going to be growing over time, usually a few months. A mole that looks different now than it did 5 or 10 years ago is probably not significant. But if it looks different than it did 6 months ago, that's probably a mole we want to have a look at. The most common skin cancers that we see are called basal cell carcinoma. And there's actually 7 different types of basal cell carcinoma, and they can have a variety of different appearances. They can look like a small pimple, they can look like a pigmented growth, they can look like a sore. They often bleed or get scabby or crusty. Men will often notice them because they will get irritated when they shave. And these are very common. 1 in 6 Americans will develop a basal cell cancer. They're very easily treatable, and the most common places where we see them are on the head and neck. About 85% of them occur on the head and neck. The most dangerous skin cancer is melanoma. This is the one that can spread and shorten your life. These are the ones that people worry about with moles turning into skin cancer. That's a melanoma that they turn into. So these lesions can be very slow growing. They're not always fast growing, but the problem is they're either undetected or ignored for a long time, which contributes to how dangerous they are and the likelihood that they will spread. And the third most common skin cancer that we see is called squamous cell skin cancer, which also occurs as a result of too much sun, usually the head and neck, and can have a precancerous lesion occurring before that called an actinic keratosis. All of these skin cancers are easily diagnosed by a biopsy, and that's where we take a piece of the tissue, send it to the lab, have a look at it under the microscope, and be able to identify what the tumor is. After you've got your diagnosis of skin cancer, the best treatment for nearly all of these is surgery. Even for melanoma, the complete surgical excision of this lesion is the first step. There may or may not be other treatments that you need to perform afterwards, but it all starts with surgery. With basal cell carcinoma and squamous cell carcinoma, very often when they occur around the head or neck, our go-to treatment is called Mohs surgery. Mohs surgery is performed in a way that we make sure that the entire lesion is gone. And the process is that we take all the tumor that we can see, and then we examine it in our in-house lab here and make sure that the margins, the edges of the tumor are completely clear. If they're not completely clear, then we'll go back in and take another layer, and we'll keep doing that until the tumor is completely clear. Once it's clear, then you're actually brought into this room right here on this table, and we repair the defect and hide the scar as best we can into your natural lines. So that's for basal and squamous cell carcinoma. For melanoma, the treatment is basically just to take a wide excision of the tumor, and then depending on the depth of the tumor, there may be other adjunctive treatments that need to be done. So with that said about treatment, what can you do to prevent it? Well, all of these skin cancers are in some way related to sun exposure. Melanoma is thought to be more related to sunburns and tanning beds, and basal and squamous cell skin cancers are more related to cumulative sun damage with regular exposure. The key then is to avoid tanning beds and use sun protection. And sun protection can take many forms. First of all, you could and should be using sunscreens, and we recommend actually that you use sunscreens every day because it's the sun which causes the aging of your skin in addition to most of the skin cancers. But you can do other things as well, like be sun smart. Try and avoid your sun exposure in the hottest part of the day. Take your run in the morning or the evening, or go for your hikes early or late in the day instead of at noon when the sun is the hottest. Wear clothing. You don't have to buy sun protective clothing. Ordinary clothing will protect you from the sun as long as it'll stay dry. Wear a hat, and don't forget to cover your ears. Wear a hat with a brim so that your ears get covered. And protect your eyes with sunglasses. That not only helps protect the sensitive skin around your eyes, but will help protect your eyes from the damaging UV and damaging blue light as well. Well, that's all from Dermatology Associates today.